Good evening. This is a video from One Good Step and Dr. A.V. Baliga Memorial Hospital. Basically, today I am going to speak about what is called as emotional divorce. I am sure you have heard this word, and it is in fact a commonality in earlier days. If you look at the India of yesteryears, say around 20 years ago, probably people say that divorce rates were very less. It's actually what was happening was many of these divorces were all emotional divorces. People used to live like husband and wife for the sake of world, or for the sake of child, for sake of their parents, for sake of prestige. But when it comes to the normal functioning of a marital life, about which I have discussed earlier also, the four facets. One is there should be affection. Second is there should be sexual relations. Third one is there should be transparency in financial issues, discussion among them. And the fourth one is rearing children. So if these four areas are taken, in a case where there is emotional divorce, both husband and wife are living under one roof, but they are uncommunicative, they are cold and distant, they don't talk to each other, and one of the spouses spends a lot of time outside the house, and even when they are inside, they will be irritable and impatient. And when others see they are in the same house, many times during therapy, we come to know that they even sleep in different rooms. They do not talk to each other. And there will be unresolved, sustained conflicts. So this is one concept which can lead to a lot of problems, because there is a lot of uncertainty. There is no proper communication between husband and wife. And so basically what happens is it creates its own dangers in the family system. If you look at children, when child rearing is looked at, what happens is there is no proper communication, and children start becoming confused. Children start manipulating the parents, looking at their differences. And of course, there is a sort of anarchy in the family, especially if the children are teenagers. Many times they do not know how to communicate to parents, what to tell them, and many a times they misuse this difference of opinion. Then of course, if you look at marital life, there is this blurring of boundaries, like what is infidelity, what is fidelity, whether they can have a relationship outside marriage when they are still in marriage. So these blurred boundaries create a lot of confusion. And of course, integrity of marriage is affected, happiness is affected. And in fact, these are the people who develop, one of the spouses, develop some psychological issues. They come to a psychiatrist with depression or anxiety, a low-grade depression called as dysthymia, and they do not know how to face it. So in fact, this is a very tricky situation for the therapist also. Many times the therapist will not be able to summon the other party, the person who is having no relation whatsoever but lives in the same house. And of course, the role of therapist, of course, would be to look at this person who has come and sought help. But many a times the therapy becomes incomplete. Many a times it leads to psychological morbidity in one of these persons. They do not know how to lead the life, and many times what I have seen is they end up in courts. They go to court, and in fact, when we talk, many times they are summoned to counseling by the courts, and then they are referred to professionals. And at this time, what we realize is both of them are not happy with marriage. Both of them want to go out of marriage. In fact, this is what is recommended when there is emotional divorce as therapists, we usually recommend mutual discussions, try to find a smooth way, go for a mutual divorce, and of course, when there are children, the responsibilities of children, and of course, things like the property both the couple have they have acquired together, and of course, the response of their families of origin of both the couples. So many issues come, and of course it takes a long time. But I as a psychiatrist, what I notice is these emotional divorces are coming less now, more because nowadays people believe in going for divorces rather than staying in marriage. This is why probably a lot of statistics are reported where they say that divorces are increasing, millennials believe in divorces. So if you look at this, what you should understand is many times if they are not happy living together, I think it's better they separate. There is always a second innings. So as a psychiatrist, I thought of talking about this mainly in the interest of children. Many times we think that children suffer a lot when parental divorce occurs. But let me tell you, if parents have already had an emotional divorce, they don't communicate to each other, they are not happy in a family, the children suffer more. So please keep this in mind, and always, what I have noticed is many times, always don't think that all emotional divorces will end in divorce. It's not true. Many times when they come to therapy, when they start opening up, when they start talking about their problems, we have seen situations where they start agreeing to disagree and start thinking of giving another chance. So what I would request you is, please consult a qualified therapist in your place, maybe a psychiatrist or a clinical psychologist or a psychosocial consultant. Give a chance to therapy. So basically, today's session, this video was intended to talk about this emotional divorce, but please understand, this is not a substitute for any therapy. This is just to give you information. We from One Good Step and A.V. Baliga Hospital, we believe in creating awareness on various mental health issues. We will be having these videos every week. There was a gap of 2 to 3 weeks because of some unavoidable circumstances. We apologize. Please do keep watching. Please do comment in the comment box, and also please give us suggestions as to what all videos you would require. We are keeping it very short. It will be maximum 10 minutes, not more than that. And the main aim is to create awareness. This is not a substitute for any psychiatric consultation. So thank you once again. Please press the bell button. Please subscribe to this channel. Thank you.